All right. Welcome, everyone. Thank you for joining us today. My name is Pam. I am the facilitator for the North Suburban YMCA for the YES program, YMCA Education Series. It's my pleasure today to welcome Denise. She is going to be talking about how to heal your heel pain naturally. I love this title. Today's session is recorded, so there will be a podcast available on our website later this afternoon. So you can also reference it in case you forget anything during the talk. These talks typically last about an hour. Denise will take questions in the chat box during this, and then at the end, if there's anything pressing, just put in the chat box. I'll make sure that she can get to it if it's pertinent. With that, we would like to welcome Denise. Denise is a licensed physical therapist, specializes in treating pain using holistic approach to discover the root cause of pain and provide natural healing options. She's been talking to us for years, and we really enjoy her talking to us. So with that, please welcome Denise Schwartz from the Manual Touch. Yay! Welcome,
Thank you so
Denise.
much, Pam. That was very lovely. Appreciate it. So as Pam said, we'll take questions at the end or in the chat box. I am going to not be able to see anybody. So if you do have a question or something, please do put something in the chat box. I think you can even raise your hand somehow in there, but I don't know how. But anyway, I'm going to close out me and all of you. So thank you again, Pam, and I'm so appreciative of the Northbrook Y that we've been able to partner these many years so I could provide this wonderful education for the community. Today, we're going to talk about heel pain, and we're going to talk about the 4 most common causes of heel pain and what to look for and how do we take care of it. As Pam said, I am a physical therapist. I am the owner of the Manual Touch Physical Therapy in Wheeling. I am at near the corner of Milwaukee and Dundee Road, so just outside the Northbrook boundary. I have been a PT for over 35 years, I think. It's a little crazy. And I started my career working in at Lutheran General Hospital, seeing people in the hospital. And within a couple of years, I stopped seeing people in the hospital, still treated them, but was just outpatient, which is what we do now, when you come to see us in the clinic. When I got out of school, I felt that back pain was the #1 reason people went to see their doctor. So I did a lot of continuing education on to become an expert in back pain. Along the way, I became an expert in treating all the parts of the body. And after a number of years, I started learning a non-traditional therapy called integrative manual therapy. It's about looking at the whole body as a whole and what is preventing you from healing. When I left the hospital, 2002, I think, I went to work for the company, Center IMT. I was one of the founders here, like franchise here in the Chicago area. And we would see people who were very complex, medical, physical problems. It was a way of using hands-on approach, working with people who really didn't get better elsewhere. And what I found when I was learning this work is all those skills I learned that I would call traditional therapy, which helped a lot of people. There were a subset of people who didn't get help from that. And in fact, they would get worse from that kind of therapy. When I started learning the non-traditional approach, those people who really couldn't handle a traditional approach could handle this non-traditional approach, and we could get them better. And what I found is when I left Center IMT to start my own practice, I decided to combine the two. So I use a whole body approach of traditional and non-traditional therapy to get people back to doing the things they love to do. I call it putting the pieces of the puzzle together, because you are a whole person. Everything works together, and we need to discover where in that puzzle do we need to begin. I have a couple of specialties in addition to working with, people who don't get better elsewhere, chronic pain, spinal issues. I also work with runners. I do run analysis. I do a very functional, holistic approach of exercise in addition to the manual therapy. And recently, in the last few years, I've added this new device called an OOV. If anybody's ever done this before, go ahead, put it in the chat box. This tool, my friend introduced me to it about just before the pandemic, and I found like it was a real missing link. It works your body three-dimensionally so you can't compensate. So I can have people lay on their back. Here's an older gentleman, it's between his back and the wall. So, you know, a lot of people as they get older, they're a little bit more hunched over. This helps lengthen you up and get you taller. Here you got another older gentleman working on some balance and integrating his foot with his body here. This is something, you know, if somebody's coming in for foot pain, this is something we would be doing. This is a much more advanced technique that my son is doing. You can see he's on one leg and I have him pulling down with a band. So all this is to get your core muscles to work, and it's to get your feet and your body working together. And that's the whole key to getting healing up any situation. During the pandemic, you created another device called a balance sit that you can sit on. And you could also do this in any position except standing, whereas this one you can stand on it. And I've been using this a lot to have people sit on it and really open up their hips, get their spine moving better, get them to it really wake up their core and their pelvic floor. Okay, so we're here to talk about foot pain, and there's a whole gamut of stuff you can do, but we sort of distilled it down to heel pain, which is something that we will see here in physical therapy quite a bit. So again, if we were in person, I might ask you, when do you have your foot pain? A lot of times people say it's first thing in the morning, it's really bad, or after sitting a while, standing up. It could hurt after activity, it could hurt with activity, it could hurt just standing for a long time. Sometimes it hurts right as you get up, and then as you move, it eases up, and it's pretty good for a little bit, and then it gets worse. So we all have to look at all those pieces and those subjective comments to discern what is really going on. Your foot has a lot. So before we get into the main causes and what we're going to do about it, we're going to do a little bit of an anatomy lesson here, okay? So this is your foot, all the bones in your foot. There's 23 bones. There's a lot of bones here. This is a view. So if you were coming like a bird's eye view down, so if you were looking down at the top of your foot, this is what you'd see. And if you cut your foot off from the bottom of your leg, okay? So you can see there's all sorts of little bones, and you got ligaments that attach to all these, and muscles and tendons, and any one of these can be a problem. Now we're talking about heel pain, and this bone right here called your calcaneus is what you would call your heel bone, okay? So when you go to the podiatrist, they often are really just looking at your foot, but your foot is attached to your leg bones, which is attached to your pelvic bones, which is attached to your spine, etc. So it's really important to look at this whole picture and what's happening, okay? Because no matter how you're using your feet, everything else is being affected. Your foot has what's called intrinsic muscles and extrinsic muscles. An intrinsic muscle is little muscles that attach within the foot itself. Extrinsic muscles are ones that begin on the leg and then come down and attach on the foot. So for example, here is your Achilles tendon, which attaches to your calf muscle called your gastrocnemius, and underneath that is the soleus. That Achilles tendon actually will attach to the bottom of your foot. There's a layer of tissue called your plantar fascia, which a lot of people possibly are on this call because they have what's called plantar fasciitis, and we'll talk about that in a minute. But that tendon attaches down here, okay? So you could have any problem all the way up here that just happens to show up down on the bottom of your foot. So it's very important to look at all that. You have muscles on the side of your leg that come down and it wraps around maybe the bottom of the foot, or it wraps around the top of the foot in order to, lift your foot up, move your big toe, be able to move your foot up and down. So very important to know all these muscles that are working. When I'm looking at someone, we want to know that your feet are working with your body. And so it's very important to understand your core. Your core muscles are all the muscles between your diaphragm and your pelvic floor. And the feet play a big role in being able to activate your core. So when we walk, when you roll over your big toe, you should activate your core to help stabilize you. So most of the time when people have pain or problem, those aren't working together. We call that neuromuscular re-education. So we got to get that working together. All right. So why or who gets heel pain? Well, it could be anybody. You could have a flat foot. You could have a high arch. You could be someone that pronates where your feet fall in. You could be someone that your feet are more on the outside like that. Okay. It could be someone who sits a lot, or it could be someone very active. So I work with runners and triathletes. They get plantar fasciitis. People who sit at home all day long, don't get out a lot, they can get it. It could be somebody who's heavy. It could be somebody who's not heavy. So anybody could get this issue. The key is how do you prevent this, and what do you do to stay on top of it so it doesn't get out of hand? So the 4 common causes of heel pain that we're going to discuss today are plantar fasciitis, a heel spur, stress fracture, or fat pad atrophy. So someone comes in with heel pain or maybe bottom of the foot pain. We got to kind of discern between which one this is so we know the best way to treat it. Plantar fasciitis, which is really common, and almost everybody has had a history of it somewhere, or they're coming in for it. It's very, very common. So what's happening is that thick connective tissue on the bottom of your foot here gets what little micro tears in it. Okay. And as it's trying to heal, it sets up little scar tissue. So it gets pulling in there and you get pain. That plantar fascia, it attaches here on the heel. So sometimes you'll have pain right in the heel. Sometimes you'll have pain here, or you might have pain up in here. But this is where it's going to show up, but we're going to probably want to treat it up in here. How do we know if it's plantar fasciitis? Usually the biggest telltale sign is that people have pain first thing in the morning when they first put their foot down and start walking, or after sitting a while. That's usually the most common telltale sign. They will also complain of pain at the beginning of a walk or a run, and then it might ease up because it's actually stretching and moving. Sometimes it doesn't, but quite often it does ease up, and it might be just fine, or it might get worse, get better and then get worse again. You'll have tenderness throughout the arch of the foot to touch. We'll find that the calf muscles that I showed you are attached to the Achilles tendon are very tight and very tender. So actually, I guess I put in here some of the treatment that we do for. So basically, we're looking if you got pain first thing in the morning, it's plantar fasciitis. The biggest key to treating that is we got to stretch out your calf, the bottom of the foot, strengthening exercises, and really good shoes, even while you're sitting at work. So one of my friends, I think it was during the pandemic, she, was working from home and wasn't wearing her shoes because she was working from home. And all of a sudden she started developing plantar fasciitis. And what happens, to all of us, including me, when we have pain, we really don't know what it means. And should we not do something? Should we not? So people don't walk normally, they protect it. And actually, that's actually the worst thing you can do for plantar fasciitis. We really actually need to move it and get it working, not protecting it. On my website, I have a tip sheet that you can download to give you some tips on what to do for plantar fasciitis. And I'll tell you, when people do you know, these things on here, within a week, their pain is maybe 50% reduced. And then it just takes time for the tissues to heal. But that severe, really gnawing pain that when people come in with it, just doing some of the exercises and the stretches that I give you, and some of the other tools, such as using the correct toes, getting the right kind of shoes and shoelacing, can make a huge difference. I want to give a little bit of shout out to this. This is a wonderful device called Correct Toes. And they're really just toe spreaders. I guess this little sign doesn't say Correct Toes on it. So I sell these in my office. They're silicone and they're a little expensive, not horrible, about $70. And there's two benefits to this. One, it helps spread out your toes, so it'll stretch out the bottom of your foot, the fascia on the bottom of your foot, to help promote some blood flow and tissue healing. And really, most important, it gets you to stand on your foot with your big toe on the ground. It'll help reestablish your arch. So you start using your foot the way your body is designed to. I'll tell you, I have very high arches and a very rigid foot. And when I learned about this about 12 years ago, I wore them, about 5 hours a day for a month or two. And I wound up needing new orthotics because my arches actually settled just enough, not huge, but just enough that I needed something new to help support my feet. So everybody I give these to really loves them. So we're here today talking about heel pain, but if you know you have a neuroma, this is fabulous. Somebody's at metatarsalgia, this can be helpful. So these are things that it's a really good tool if you're having some foot pain. Shoelacing. When I discovered this, I was like, who says you need to lace a shoe the way it's traditionally laced? So in this case here for plantar fasciitis, not often that I'm necessarily relacing their shoe. However, when I find someone comes in and I notice they have a rigid midfoot, and like me, we might need to, let's see where, like right here, you can see how it skips a hole here, and it opens up this space here. So it allows your midfoot to move a little bit, and it doesn't have to work so hard. If there's anybody in here like me who has big toe arthritis, you need to open up the toe box. So you can see here, we didn't cross here, and we open it up down there. We open it up down here. So the toe box is more open. So these are real simple tools that really help kind of get you through healing and really get your foot in a position that we want it to be and working for you. I added just a little, we're not here to talk about the big toe, but I want to give a little shout out because the big toe is really, really important. If you injure your big toe, do not wait. Get to see someone. You might need to be in a boot. That big toe, we need that to walk over and walk as optimally as possible. So you always want to take care of your big toes. You know, we stub toes and we break toes, but if you break or injure that big toe, there's some treatment that needs to be done. I myself, I was a runner, and then I started developing arthritis in my big toe. And a few years ago, I kept putting off, like most people, going to the doctor. I knew it was a problem. My toe would kind of lock up. And I think it was in November during the pandemic, my son and I were painting 2 bedrooms. And so I was going up and down ladders, getting down on the ground. And after 3 days of painting, my big toe flared up so badly, it was hard to walk. Finally went to the doctor. He x-rayed it. You're ready for surgery now. So a few months later, I wound up having big toe surgery. And then a few months after that, the other big toe. I had some torn cartilage and needed to clean it up. So the big toe is very important. I keep my shoes, and I have teeny weeny feet. I'm a little person, but I need a wide toe box. So I lace my shoes like this. I periodically put my correct toes in to help as well. All right, back to heel pain. So we talked about plantar fasciitis. The second most common is a heel spur. And a lot of times when you go into, if you happen to get an x-ray, they might see a heel spur and it may or may not be a problem. But more than likely you're getting an x-ray because you have pain there. I find that, so I don't know if you've ever seen an x-ray with a heel spur. I couldn't find a good picture to show you, but it really looks like a fang. You'd think it's it looks so sharp and pointy. It's crazy that it causes severe pain, but it's bad, but not as bad as it looks. And what happens is that heel spur is because the plantar fascia, which attaches to the heel, if it's tight and the calves are tight and it pulls on that bone, the bone kind of senses that it's getting injured, so it builds up more calcium to try to protect it, and over time a spur is developed. You may get a spur without having plantar fasciitis pain, or you might have both, or you might have one or the other. So it goes hand in hand. It could be any of the above. Sometimes you just have a heel spur, and the best thing you really can do, you have pain with weight bearing. When I poke on it, it doesn't hurt a lot. The best thing we usually do is there's usually some orthotics or heel cups that we'll put in there. The third most common cause of heel pain would be a stress fracture. And this would be, it hurts with weight bearing. Every time you step down on the foot and it does not ease up, it gets worse. Pain does not decrease with movement, which is more of a soft tissue issue. You may have throbbing pain when you're just sitting or at rest. And, we could really find a real specific spot on the heel that's really a problem. So many times you need an x-ray to discern between stress fracture and a heel spur. You sometimes might need an MRI as well because it may be so minute. The last thing we need to discern if you're coming in with heel pain is the fat pad on the bottom of the foot. Right here is a fat pad. Okay, and that kind of looks almost like, if you look at the bottom of the foot, it looks a little roundish, dome shaped. That's your fat pad. And over time, as people get older, and sometimes when you're young too, that fat pad decreases. You lose the fluid in it, and it atrophies away. And so it's a thinning of that area, and because of that, you're a little closer to the bone, and you get irritated. So you get pain with weight bearing. And the best way when they come in to see me to discern if there's some fat pad atrophy, is I might hold the back of the heel and squeeze it together and tape it in such a way and then it alleviates the pain. That's often, so you're sort of creating a pad out of the heel tissue that's still there. Okay, there's some little tips or some testimonials on how people have gotten better here. I should mention, if you would like a copy of this PowerPoint, a PDF copy of it, and some ebooks, please put your name, first and last name, and your email in the chat box, and I'll be happy to send this to you. So what's the number one mistake that people make with heel pain? They ignore it. So I had big toe pain. I kind of ignored it, but I treated it as well. I worked with it, with my hands, and I wore my correct toes. So I did a lot that I could on my own until it was time to go get it taken care of. And it's very important to figure out what's really going on, because it'll dictate how we give you exercises and the treatment. So how do we know if therapy will help? Physical therapy will help. Well, we want to make sure it is reproducible, because then we know we can reduce it. So if you come in and you tell me very specifically when it hurts and when it doesn't hurt, that's reproducible. If you come in and tell me it hurts all the time, it doesn't matter what position you are in, you can't seem to get rid of it, there's nothing that takes it away, then it's probably not reducible. So we need to get some more testing and figure out what's going on. However, sometimes people with other chronic pain situations, that may or may not hold true. So it sort of depends on the case. But in this case with heel pain, we really want to be able to reproduce the pain and knowing that we can reduce it then. So when you get pain, what are your choices? You can ignore it. Oh, maybe it'll go away. I'll just rest. I'll stop doing what aggravates it. Maybe you'll go to eventually decide to go to the doctor, and the doctor might give you ibuprofen. They might give you a steroid shot. Maybe at some point you might need surgery. Or we can handle it, which is physical therapy. Now, all three of these, there is a place for all of those things. I think ignoring it is never a great idea. Sometimes resting is a good idea, or stopping a certain activity is a smart idea. But that doesn't mean you're ignoring it. You're making conscious choices to do something about it. Sometimes people do need that injection to get them over the hump. They may need some steroids or anti-inflammatories. Hopefully surgery is a last resort, and you try to do something to take care of it and figure out why you got that problem. So with all the different diagnoses that we talked about, there is a reason that people got those problems. And usually it has to do with something mechanical, or which means how do you move and what's your strength like? Are you weak? Are you moving as optimally as you're supposed to? And most of the time we all move subconsciously. We just get up, we walk, we sit, we stand. As one of my older gentleman patients said, I'm 80 years old and I've been walking my whole life, and now the last 5 years I need to relearn how to walk again. Nobody taught you how to walk. Nobody taught you how to sit. Nobody taught you how to stand. As we get older and things change in our bodies and we compensate to function, at some point those run out and we develop pain issues, degeneration. And so this is why you need to see a professional, a physical therapist, to take a look at what kind of went haywire and what can we do to fix that. So we're going to work on fixing your mechanics, getting your body to work as optimally as possible together. Remember, we had those dancing skeletons. We got to look at everything besides your feet. We got to look up all the way up. What are your legs doing? What are your hips doing? What's your back doing? All the way up into your upper back or your shoulders, and vice versa. If you came to me with back pain, 9 times out of 10, I'm sending you to get new shoes, because the shoes are not protecting you, because there's something going on there. I find as people get older, their ankles become very rigid and stiff, and that limits your ability to move optimally, which causes stress and strain somewhere. Okay, so we talk about mechanics, which are really more of the bony alignments and getting all the joints to move the way they're supposed to. Dynamic stretching, this is a way of, instead of holding a stretch, you move your body to get your body to ease in and out of the stretch. Strengthening, give you targeted strengthening exercises. This will be more of a whole body approach, not just the foot. It's, most of the time there's stuff going on in your hips, and that's why your foot fell apart, or vice versa. Your foot had a big problem, and so then your hips didn't do what they were supposed to do, and the hip fell apart. So we got to look at both of those. And I'm going to look at shoes and possible orthotics. Sometimes over the counter is good enough, sometimes custom. I myself I'm 60 years old now. I've been wearing orthotics since my 30s. I have very high arches, very rigid feet. I had some other little abnormalities in the foot, and so I need them. Not everybody with plantar fasciitis needs a custom orthotic. Sometimes an over-the-counter one will work. I like to see people for a couple of months to do their exercises, to get them stronger, to start seeing if we can get things working together. And then their body is in a position to determine, should we get an orthotic now or not? Because things are going to change when they're in therapy the first couple months. So I don't usually send people to get an orthotic made right away. Getting an over-the-counter one is fine. Usually the good shoe stores such as Fleet Feet or New Balance have good ones, and they can guide you on which ones to get. So when you come into physical therapy, we talked about doing some fixing mechanics, which is a lot of hands-on work, manual therapy, working on balancing all your joints, reducing any soft tissue restrictions. I'm gonna skip the education in a second. Exercises, strengthening what needs to be strengthened, mobilizing, stretching. I like to call it mobilization as opposed to stretching, but it's like stretching what needs to be stretched or mobilized. A balance, super, super important. That's the beauty of those correct toes, really help you with your balance as well. Unfortunately, those correct toes don't, usually when you're wearing them, they don't fit with your shoes that you have. So I'll have my patients do some of their exercises with the correct toes and a pair of socks over them. And then and wear them around the house with some, slippers that are usually wider toe box, such as Crocs or Birkenstocks. And then the other times you won't wear the correct toes. At any rate, that helps activate your core and get your feet and your core working together, which we call neuromuscular reeducation. And then a big, big component of physical therapy is really teaching you how to function again, so you don't keep aggravating the painful area, getting new aches and pains or injury. So we're going to talk about how to sit, how to stand, how to walk. What are the best shoes for you to get? How to move through a transition, which meaning you're going from a sit to stand, stand to sit, rolling, laying down in bed, sleeping position, lifting, posture, and specific activities, how to do things around the house. And if you're do sports or exercise regularly, we'll work on those things. So if somebody plays tennis or pickleball or a runner, we'll work on very sport specific exercises like that as well. This is a blog post that I wrote about or a link to a blog post how to choose shoes and what to do when you go to the shoe store. So in this PowerPoint, I have a lot of links to specific articles on my website. So again, if you put your name, first and last name, and your email in the chat box, I'll be able to send you this PowerPoint. It'll be much easier for you to find things. These are some of the ebooks I have available as well that I will send you when I get your email. This is tips on how to function for anything you do all day long. This is some basic balance exercises, very, very important. When the foot is a problem and you can't put weight on it or it hurts too much, your balance is going to take a hit, and we don't want you falling. I don't know if we have any runners on the call today, but heel pain is pretty common. Runners, plantar fasciitis. So this is a running ebook that I have. So as a thank you today, I'm happy to do a free 20-minute consult with you by phone or telehealth to discuss what's going on with you and provide you with any recommendations. Just give a call to my office and Jenny will set you up with that. So thank you for coming today. I hope that was informative and you enjoyed it. I am going to stop the share, and if you have any questions, I'm happy to answer anything that you might want to talk about, whether it's heel pain or something else today. I'd be happy to answer any questions about aches and pains and what may be going on. Let's see in the chat box, is there anything here? Okay, no questions in the chat box. But if you want to put your name in the chat box and your email, I'll be happy to send you all this information. All right. Well, thank you very much. I appreciate it. I believe, Pam, I'm doing another talk next month. I don't know if Pam is still there. She should be, but hold on a second. I need to, there we go. Okay. everybody's email that wants to put it in there? I only have a couple right there. Anybody else?
Perfect. Give me one.
I think
Awesome.
I'm doing a talk next month, right?
Yep, you are. Yep. Yep. You are doing a talk next month on, let's see, it's on the 3rd for Thursday. Sorry, I normally have this up. Boom, boom,
Yes.
boom.
Let's see, maybe the 18th. What's today? The 15th is probably the 15th next or 16th next month.
Yep, it is. Let me
Because it's
see.
leap year. Or maybe
All
it's
right,
the
next
21st.
month, Denise is talking about hip pain on March 21st at noon. So on the 21st at noon, we will hear from Denise again. We do have another talk next week at Thursday at 11 a.m. about dementia, how to facilitate family conversations about aging. So a little bit about dementia there, but more about family, talking about families with that. So definitely put your email in the chat box if you would like Denise to share her stuff. And yeah, great. Awesome. Thank you so much. This will be posted later on today. And thank you to Denise for another talk. We will have her in March, but then also in April 25th, she'll also be doing a talk. So excellent. And we look forward to seeing you again next month on the 21st.
Thank you. Thank you for having me.
Bye, everyone. Thank
Take
you.
care. Bye-bye.